When we hear the word chemotherapy, we think of it as a life-saving treatment, our best weapon against cancer. It's the go-to protocol for millions of patients every year, with the hope that it will shrink tumors, kill cancer cells, and offer more time, more life. But what if I told you that, in some cases, chemotherapy might actually help cancer spread? It sounds shocking, even controversial, but emerging research is painting a more complex picture. It doesn't mean chemotherapy never works, but it does mean we should take a closer look at what else it might be doing inside the body. In this video, we're diving into the lesser-known side of chemotherapy, how, in certain circumstances, it may contribute to metastasis, the spread of cancer to other parts of the body. We'll explore the real science behind this possibility, including studies that highlight how chemotherapy can change the tumor environment, alter the immune response, and even prepare distant organs for cancer to grow again. Let's break it all down. To start, let's clarify something. Chemotherapy is designed to kill cancer cells, and in many cases, it does exactly that. But cancer is notoriously complex, and sometimes the body's response to chemotherapy creates a chain reaction that can backfire. One of the main mechanisms being studied involves something called TMEM sites, short for Tumor Microenvironment of Metastasis. These are clusters of cells in tumors where cancer cells can enter the bloodstream and travel to other parts of the body. A 2017 study published in Science Translational Medicine by Karagiannis et al. Found that chemotherapy, specifically paclitaxel, increased the number of these TMEM sites in breast cancer. More TMEM sites mean more gateways for cancer cells to escape the primary tumor and potentially seed new tumors elsewhere. Another major issue is inflammation. Chemotherapy causes tissue damage, and when that happens, the immune system responds with inflammation. This isn't necessarily bad, it's part of the healing process. But cancer is clever. It can use that inflammation to its advantage. For example, a 2018 study published in the Journal of Experimental Medicine by Liu et al. Revealed that chemotherapy-induced inflammation actually strengthened cancer cells, making them more resistant and more likely to survive in new locations. Adding to that, chemotherapy also recruits immune cells like macrophages and monocytes. You think that's a good thing, right? Well, it depends. Some of these cells, especially tumor-associated macrophages, can actually support tumor growth and suppress the body's anti-cancer defenses. In 2011, DiNardo et al. Showed in Cancer Discovery that chemotherapy led to an increase in these macrophages, which ended up promoting tumor progression instead of halting it. But it doesn't stop there. There's another process known as EMT, or epithelial-to-mesenchymal transition. This is when stationary cancer cells transform into more mobile, invasive ones, cells that are far more likely to spread and metastasize. Research from Chang et al., published in the Proceedings of the National Academy of Sciences in 2017, showed that chemotherapy can induce EMT, making cancer cells more aggressive. Imagine a tumor that was mostly sitting still. Chemotherapy, instead of wiping it out, might be nudging some of those cells to break away and explore new territory. Then there are exosomes. These are tiny vesicles that cancer cells release into the bloodstream. Think of them as microscopic messengers or packages. Under chemotherapy stress, tumors release more exosomes, and the contents of these packages can actually prepare the soil in distant organs, making them more welcoming to traveling cancer cells. A 2018 study by Keklikoglu et al., published in Nature Cell Biology, showed that chemotherapy-induced exosomes could promote lung metastasis. So while the primary tumor might shrink, these exosomes are quietly paving the way for cancer to take hold somewhere else. And let's not forget how chemotherapy can alter tissue environments. A paper by Middleton in International Journal of Molecular Sciences explains how chemo can create conditions in distant tissues that are more favorable for cancer growth, almost like turning a cold, hostile environment into one that's warm and inviting. It's as if chemotherapy, while attacking the main tumor, is also sending out construction crews to prepare new homes for the disease. We're not saying this happens in every case. Chemotherapy has undoubtedly saved countless lives. But if we ignore these findings, we risk missing the full picture. In fact, Shicade's 2016 review in Nature Reviews Cancer described how the host response to chemotherapy, including inflammation, immune changes, and tissue remodeling, can, in some patients, end up supporting metastasis rather than preventing it. And in 2011, a study by Cengiz Filitsky et al. In Cancer Research found that chemotherapy can upregulate pro-metastatic factors, essentially giving cancer cells more tools to invade and thrive. So what does this all mean for patients? It's important to understand that these studies don't say chemotherapy is always harmful. Instead, they highlight a paradox. While chemotherapy is fighting cancer, it may also be reshaping the battlefield in ways we didn't anticipate. The increase in TMEM sites, the rise in inflammation, the recruitment of immune cells that assist cancer, the spread-boosting exosomes, and the tissue remodeling, these aren't theoretical possibilities anymore. They're being observed in real biological systems. Let's talk about what this might look like in real life. Imagine a patient undergoing chemotherapy for breast cancer. The tumor shrinks, which is great. But during that same time, chemotherapy might be increasing inflammation around the tumor, helping cancer cells escape through TMEM sites and triggering changes in other organs like the lungs or liver, essentially laying down the welcome mat for those cancer cells. A 2020 study published in Seminars in Cancer Biology by Dalterio et al. Summed it up well. Chemotherapy doesn't just act on cancer cells, it also acts on the environment around them. That includes blood vessels, immune cells, connective tissue, and more. And those effects can influence whether cancer comes back, and where. Even the way cancer cells communicate with the body changes. As mentioned earlier, exosomes, tiny vesicles released by tumors, carry signals that prepare distant tissues for metastasis. When under chemo stress, tumors release more of them. These exosomes can change the behavior of surrounding cells, modify the immune response, and even break down barriers that would normally keep cancer out. This is what researchers refer to as the fertile soil theory. Cancer cells are like seeds. They can only grow if the soil is just right. And chemotherapy, for all its benefits, may unintentionally fertilize that soil. Another major factor is timing and dosage. Studies show that some of these pro-metastatic effects are more pronounced at specific chemo doses or after repeated treatments. For instance, Nakasone et al., in a 2012 cancer research study, found that repeated chemotherapy doses recruited monocytes that facilitated metastasis in mouse models. So what can be done with all of this information? First, it doesn't mean we throw out chemotherapy, but it does mean doctors and researchers should think carefully about when and how it's used, and whether it should be paired with treatments that counteract these unintended effects. For example, targeting the TMEM sites or reducing chemotherapy-induced inflammation could be potential strategies to block metastasis before it begins. Researchers are actively exploring these paths. Some trials are even combining chemotherapy with drugs that inhibit macrophage activity or prevent EMT to reduce the risk of cancer spreading. We also need better personalization. Not every tumor behaves the same way. Some patients might benefit from chemotherapy without triggering these side effects, while others may be more prone to them. If we can identify who's at higher risk for chemo-induced metastasis, we can tailor treatment accordingly. As strange as it sounds, chemotherapy may need a partner therapy to block its darker side. That could mean anti-inflammatory agents, EMT inhibitors, or even immune modulators that prevent the recruitment of tumor-promoting macrophages. It's also a wake-up call to patients and practitioners to ask deeper questions. If you or someone you love is considering chemotherapy, it's okay to have a conversation with your doctor about these risks. Ask about supportive therapies, complementary treatments, or alternative strategies, especially in cases where the cancer is slow-growing or hasn't yet spread. And let's not forget the emotional weight of this discussion. For many, chemotherapy is the only option ever presented, and when it doesn't work, or when cancer comes back stronger, it can feel like a personal failure. But the science tells us something different. Cancer is cunning, and sometimes the tools we use to fight it need refining. We are not anti-chemotherapy. We're pro-truth, pro-patient, and pro-transparency. Patients deserve the full story, the benefits, the risks, and the ongoing research that might change the way we approach cancer forever. As we wrap up, here's the takeaway. Chemotherapy is not a villain, but it's also not a miracle. It's a tool, sometimes life-saving, sometimes flawed. And like all powerful tools, it needs to be wielded with care, precision, and knowledge. The science is evolving. And the more we learn, the better we can fight cancer, not just harder, but smarter. So, what do you think? Were you surprised to hear that chemotherapy might play a role in helping cancer spread? This isn't about fear. It's about being informed, empowered, and proactive about your health. The more we question, the more we understand. And when it comes to something as serious as cancer, we owe it to ourselves and our loved ones to explore every angle. If you found this video helpful, make sure to like, share, and subscribe to Addicted to Health for more truth-backed insights on wellness, disease prevention, and the powerful choices you can make every day. Stay curious, stay skeptical, and stay healthy. We'll see you in the next one.